you mentioned about New Zealand just popped up, and again, this is what we had such a great conversation before starting to record. It was such an organic conversation. I hope that we can capture what we were talking about. But obviously, in New Zealand, their term isn't BHC, and actually, it seems like they have a couple different terms depending on the population that they're working with and the clinic that they're working with. So, Patti and Jeff, both, do you feel like consultant is like you have to use that term for consultant, or what's your view on people using different terms?
Well, I think it's most important that the PHC is trained in competencies, and in being trained to do the work, they create the relationship that they need with the team and with patients so that it works. So honestly, the name kind of becomes beside the point in a way. So it becomes BHC, or it becomes Bridget, or it becomes Jeff, or it becomes Patti, and rather than behavioral health consultant. And I think it becomes kind of, if it's an abbreviation, it's like it's an abbreviation, but it's also not just a noun, but it's a verb. So like in New Zealand, they call themselves health improvement practitioners. And so they talk about, well, am I hipping now? Or can you hip this person? And just like at David Bridges' clinic, we're talking about where they say, can you BHC this person? So I think it just becomes a name, a symbol for what it is that we do. And that happens as a result of relationships we create with the team. So I kind of hold the name lightly. I've been working recently in an area that serves a lot of Maori and Pacific people. And so they call the BHCs there Matenga Whaioras, which kind of in Maori loosely means like someone that assists you on your path to wellness.
Awesome. Yeah, that's super great.
And yeah, I would say something similar. I think that, I'm not necessarily myself wedded to the term behavioral health consultant. I've never loved the term because I do think that term consultant, like I was saying earlier, gives some people a misimpression that as a consultant you're, less engaged or something like that. So, or you're doing kind of only simplistic interventions with patients, simplistic symptom reduction interventions or something like that. So I think people have that misimpression a lot from that term consultant. So, but I've just personally never been able to figure out any other title that makes more sense for what we do, because that piece about, as a consultant, the primary consumer is the PCP, and the way that the consultant follow-up structure is different from a therapist follow-up structure. Those that really describes what we do in the PCBH model. So I've just never really been able to come up with another term that is better. But the one, I guess, caveat I would have about if we do get into using different names and different systems is then you develop kind of a standardization problem, and it becomes hard to kind of understand, are you doing the same thing in your system that I'm doing in my system and just calling it something different, or are you doing something different? And this issue of kind of a shared language, I think, is really important for building a model and disseminating a model and whatnot. So, it's kind of like, if you look at primary care providers, there are some differences, in what they're called. Like in the military, they're called primary care managers, or PCMs. In some other systems, Patti was just mentioning in Oregon, they're called primary care clinicians, PCCs. Mostly, though, they're called primary care providers, PCPs. Most everybody, even lay people, know what a PCP is. And they may not, if you break down that term, primary care provider, a layperson might not know really, well, why are they called providers, but they know what a PCP is, though, and that's helpful, for communication. So I do think there's something to be said for having a standard, title for that we use for the behavioral health providers who do what we do in the PCBH model. Whether that's behavioral health consultant or something else, that part, I'm not personally all that wedded to. But I do get a little uneasy if we start to get into, every kind of system calling their BHP something different.
I think that